out when you're done.
Thank you so much, Grace, and thank you to everyone who has persisted to this moment. I am Donna Cryer, CEO and founder of the Global Liver Institute, and proud to be here with my fellow patients and patient advocates. Wayne, you did a tremendous job. Don't let anybody take that away from you. If nothing else, having watched your slides evolve over the course of these years, you should be very proud of where you are now. But your organization is so much more. So I think we do have just a brief snapshot, if I give a moment for my introduction, but I'm so much more interested in hearing and introducing, haven't met everyone else on this fantastic panel. So my remarks will be brief. As most of you hopefully know, the Global Liver Institute convenes the NASH Council and has done so for about 3 years. We are about 70 members at this point across stakeholder groups, medical societies, industry members, all the patient advocates here, as well as organizations like the American College of Sports Medicine and preventive cardiology nurses, and so many others who come together to create a much broader coalition to address liver diseases than frankly we've ever had for any type of liver condition. I think as Wayne has pointed out, the connection with so many other concurrent conditions like obesity and diabetes, NASH really is a public health issue and needs to be addressed as such. And so we talk about that in International NASH Day, and also the role that non-invasive technology plays in a Beyond the Biopsy campaign. So if you've seen any of those logos, those are all me and my fantastic team at GLI spread now across 2 continents. But I am most interested in, and maybe we'll go around the horn in, can't possibly see the direction that I see in my lovely gallery screen, but we can start with Tony Villioti from NASH Knowledge with your fantastic background. Clearly you are our technology Gold Star winner for the evening. And so maybe we'll just go around and tell everyone, who you are, just a little bit about your organization. We know that you are backstopped by your lovely care partner, Betsy, and co-founder as well. So we'll let you all split between the 2 of you, how you'd like to introduce us to your organization. And then I'll make several more rounds so you'll have opportunities to talk about your priorities and things as well.
Okay, I'm Tony Villioti. As Donna said, my connection with NASH began as a patient. I had fatty liver, was diagnosed with NASH and cirrhosis at the same office visit. That progressed to cancer, and I had a liver transplant in 2018. That led me, because of my experience and understanding how little I knew about my liver and finding out that other people were pretty much in the same boat, we decided to form our nonprofit which has a mission of increasing awareness of NAFLD and NASH. So I'll leave it to Betsy to talk a little more about what we're doing.
I guess I'll go. As I'm Tony's wife, and one of the things we do in NASH, I have a support group that I run with NASH, and through my support group, we found that, well, Tony's not the typical patient, as you heard, if you heard Wayne's speech. The typical person with NASH tends to be in their 40s when they get diagnosed. And what we're finding is that people younger and younger and younger are having NASH. The youngest person to be diagnosed in my group was in their late 20s, and the oldest person diagnosed was in her mid-50s. But the average group of patients diagnosed with NASH in my group is in their mid-40s. And we're finding out that younger and younger. So in NASH education, that's why we decided to do a pediatric, and we started a project called CLEAN, which is Children's Liver Education and Nutrition. And we're hoping that we can make more people aware of the importance of their liver and liver health.
Betsy, thank you. I think that's so important. You know what, as we go around, because I am familiar with all the great work that is being done, I think it's so important for people to realize that each organization has taken a piece of this big NASH puzzle. And I think as Wayne's work with his study has shown, we are redefining sort of expectations for patients and patient advocacy. And so it's been so exciting to see everyone really hone in on a particular problem or barrier and focus on addressing that. I think, you know, together we will really get a handle on comprehensively solving this problem of NASH. But Rosemary, you are next on my screen. So.
I am. Well, hopefully many or all of you saw Wayne's presentation just previous to this, so I won't spend a lot of time talking about fatty liver. I am the COO, and actually I'm Wayne's caregiver, so I'm here representing the caregiver patient voice, if you will, for this event.
Fantastic. Lindsay?
Hi, thanks, Donna. I'm a national manager for outreach and education for the American Liver Foundation, but I also wear the hat of a patient myself. I was diagnosed with NASH just about 6 years ago. I have since, resolved it with some lifestyle changes and a lot of hard work with my doctor. And I am a caregiver. I took care of my mother before, during, and after her liver transplant due to hepatitis C. So we are ahead of the game with our public health diseases in our family. I also had hep C, which is what led me to asking my doctor to screen me for NASH, because I had symptoms that were reminiscent of viral hepatitis infection. So I am pleased to be here with all of you and to be taking part in this event.
Excellent. And so, Wayne, you now need no introduction. But
I need to apologize for that train wreck that we started with, though.
Never. I know you may have seen like the highlight reel from Eli yesterday. So all the different things that have handled, swooped in and out and misapplied my lashes and things. So no apologies necessary. But maybe you can start us on the sort of question and conversation. So we've had 2 days of this NASH summit, some really fantastic panels addressing a variety of concerns, but we've all lived with it and spend our time immersed in the questions that patients have and the issues that patients face. And so, having digested 2020, which has been a tumultuous year in liver health, in the NASH field, many times cataclysmically disappointing, at other times simply scary as we try to figure out how COVID affected liver patients and saw the information that was emerging connecting NASH and COVID. And now coming into the fall, with a vaccine and the promise of what 2021 may hold. So looking ahead to 2021, Wayne, what do you most want either your organization or the field of NASH itself to be able to accomplish?
Well, you have to temper absolutely everything through the COVID lens, because it disrupts all the things that we would like to do. But just a word about the program and the industry or the science. This is amazing what they're doing. I'm just so impressed by the progress that the science people are making, and so we're tremendously encouraged for the future of therapies and understanding of this health. But I suppose our greatest need from our perspective is that this is not, it's not a normal disease problem. You know, if you had some issue, maybe it's tuberculosis, or maybe it's, you know, acid rain, or whatever it is that's killing people, and you know what it is, you go out and you do something about it. And all of these diseases are part of our lifestyle. I mean, we have brought these into our families unknowingly, but now we really know that the way our society is operating is unhealthy. And we talk about wellness, but what do? I mean, you think about the primary care gap. You know, we
So Wayne, what do you most want to happen in 2021?
What I most want is to focus on the societal changes that we need to make to have this not continue to be a disaster.
That's fantastic. So that's food policy. So, you know, we have new secretaries of and experienced pre-nominee for Secretary of Agriculture for the SNAP program and other things. So, you know, there are a whole host of new people to educate and focus on a liver health agenda coming up in January. So, Lindsay, what do you hope that you know, these new folks and those who have been you know, who will still be there working on these issues, what do you hope that they really understand and can accomplish with us or on our behalf next year for NASH?
I think one thing I would love to see happen is a more standardized approach to screening for HCC in NASH patients, with the knowledge that it does break out pretty routinely from the traditional progression of liver disease. And, you know, while industry continues to work on liver cancer, there's still a huge gap there. So making sure that we can diagnose people when there are options available beyond, you know, transplant, especially. So I guess I'd love to see that in addition to just a wider conversation among the general public. I mean, I think Wayne said it very well that this, and as did you, that these are public health concerns, and we need to leverage the public to make a difference.
Your point about screening is so important, and connecting diagnosis and screening of NASH itself, you know, the progression of NASH, and then, you know, appropriate referrals to hepatologists for people in advanced stages, and you know, screening for liver cancer, and making sure that people don't find out their NASH, you know, status or diagnosis when they're in a transplant clinic, right, Tony? Cancer. So whole care pathway for NASH patients that has more confusion than clarity. You know, I think that's absolutely right to spotlight for, you know, for making tighter, for making better next year in partnership with clinicians and medical societies and hospitals and health systems. I think that's fantastic. Tony, since you've been in that point of, I'll come back around, but Tony, since you've been in that point of having that diagnosis sort of at the wrong point, you know, way after you had the opportunity, like Lindsay and Wayne, to sort of, you know, reverse things or have interventions that were much less intense than the transplants that you and I have gone through. You know, what would you say, and what would you and NASH Knowledge want most to see happen in 2021?
Our top priority is raising awareness. There's a huge gap between the number of people that have this disease and the number of people that know they have it. And also even the number of people that have even heard of NASH. At last year's NASH summit 18 months ago, there was a survey presented that showed that only 2% of the general public and 6% of the people with one risk factor had ever heard of NASH. So my priority, our priority, is just to narrow that gap. And we're going to continue to do the things we have been doing with our documentary and our educational materials, but we're also trying to attack this at the family level, because I think the core issue with the lack of awareness is that people grow up without knowing how important their liver is, what it does, and how to keep it healthy. So that's why Gina, my daughter Gina, had a poster presentation this morning on our CLEAN program, and we're working hard to implement that. And while it sounds like a long-term solution, it's really not, because if you make the family aware of it, I go back to the days when the kids got on my case about wearing a seatbelt. If we can get the kids, lobbying for less sugar, that would be a major step forward.
And I don't want to gloss over the point of your fantastic documentary that Wayne also had a role in, and it's on PBS stations. And where can people find it to watch that now?
It's on our website, nash-now.org.
Fantastic.
And you can't miss it. It's on the middle of the homepage.
Well, I want to make sure that no one misses it. I think as we are trying to communicate the realities and create the urgency around treating NASH, both creating medications for it, or going all the way to where you're going, starting way upstream, and the urgency around preventing children and young adults from ever having to know it or experience it in the way that we have. That's so important. That's so important. So I want to make sure that people have that particular tool to be able to communicate the impact of NASH families, because it's not just an individual. Betsy, you filmed most of it. We shared your confusion and horror as you were watching it unfold, as Tony was experiencing a lot of the symptoms and complications of the disease. Betsy, how are you translating, that experience that we saw in the film and that, we've talked about with you, into the support that you give to others, and the work that you're doing and scaling now?
Well, I think through the pain that we went through, that became our passion to get the word out, to make people more aware, and the urgency that's needed. And I'd just like to say, in our CLEAN project, just talking to one of the pediatricians, hepatology pediatrician, he said the youngest patient that he had with NAFLD, this is a person with NAFLD, is 5 years old.
Wow.
That is like scary. So it's urgent. We need to get it out. And I think we also need, like in my support group, almost everyone who has NASH, all but one person actually who has NASH, their doctor did not tell them the consequences of fatty liver disease. And like I said, only one person out of everyone that I have in my group. So I think we also need to get the primary care physicians on board. I know they're busy every day, but they need to do this. So there's just like a strong urgency. And I think if we and industry and all these groups get together, I was in one conference where they said that we may have already lost a generation, that meaning the 40 and 50-year-olds. So please, let's get moving on this. We don't want to lose another generation.
I have to admit, as you were describing the risk to people in their 40s, at first I started to identify, and then it occurred to me, I'm like, Donna, you're no longer in your 40s.
Oh,
Like,
40s and 50s.
Oh, well. So, I think, though, that the emphasis on children with NAFLD and NASH, maybe the wake up call for the nation. It certainly is one of the reasons that, the move to non-invasive diagnostics is so important. Having had 6 liver biopsies myself, I can't imagine, biopsying, a child, and sometimes it's necessary, of course. But if we think about how many children, teenagers, young adults are affected with NASH, the thought of scaling up and having thousands, hundreds of thousands, millions of biopsies, multiple times to monitor treatment response is unimaginable. We can do better than that. And I think with the evolving technology and diagnostics, we can do better, and we need to make sure that we have a regulatory system that acknowledges that. We have a question here from the audience. What solutions, next steps would you propose to improve the awareness of liver disease? And what are the key steps to improving screening of asymptomatic patients? So I will let, if someone raises their hand, otherwise I'll take the awareness question. Lindsay, oh good, I was hoping. So yeah. Lindsay, about awareness, and then Wayne, I'll let you, and Rosemary, maybe I'll let you talk about screening.
I think one of the big things with awareness is so few people know what their liver actually does and how important and essential it is. We rarely think about it until there's something wrong with it. And usually by then it's too late. So I think, prior to COVID, I was out in the community every day and talking to people about what their liver function does. And I think the more people can be in tune with how many different things can affect the liver beyond alcohol, that not only will alleviate the stigma of talking about our livers and awareness and being comfortable talking about having liver disease, but I think it also will help people think, twice, think about their liver a little bit more with medications and supplements and food and, beyond just kind of the age-old knowledge of what the liver does. I think that's huge.
Right. So Rosemary, I'm going to, I want you to comment on either screening or awareness. And then our producer here has said I should segment and allow them to close this edition of the NASH Summit. Rosemary?
Screening is so incredibly important. It's been really frustrating to hear that, let's not screen because we don't have a treatment. But if you don't screen, people don't know that there is a problem. They're making themselves worse each day. And there seems to be an underlying assumption that even if people know, they're not going to do anything about it. They're not going to lose weight, whatever it happens to be. And that I'm sure that there is a group of the population where that's true. But what I see on a day-to-day basis is that people are shocked when they have it. They wish they had known sooner. They are willing to try. They would be more than willing to help us identify what they need to be more successful. And I really think we have to understand this, because we need to get to the point where screening isn't required, because people understand what a healthy lifestyle, a healthy diet really is, and that they're not coming down with this disease. They're not even facing it. That's my ultimate long-term goal. I hope that makes sense.
It does. I think that we should all be so successful that we put ourselves out of business.
Right.
That there is no need for organizations, because people are so healthy that they don't need us. Having walked back from starting my career and investment in this because of my transplant, I've been trying to walk back to prevention and public health throughout the rest of my career. So I think you all have made such fantastic points, and I want everybody to appreciate the work that all of you do on behalf of patients, not only in the United States, but really around the world in so many aspects of this. We will be, as far as my hopes for 2021, on Monday we'll be launching our U.S. NASH action plan that will have very specific recommendations for every stakeholder group to partner with us and the NASH Council in addressing this in the new year. And I think it's sort of a natural follow on to the International NASH Day, which we hope everybody will join on June 10th next year. Read the language of NASH reports so that we can talk with one voice and one message with this. Join the Beyond the Biopsy campaign so that we can rationalize how people are diagnosed, and support initiatives like Wayne's son study. And really everyone coming together in a coordinated, comprehensive way can address this challenge of NASH. I've actually never been more optimistic about the science, Wayne, as you put out, more optimistic that Lindsay, your community activities will resume and you will be out there. More optimistic that the way you reach out to people, Betsy, in your support will only touch more lives. That Rosemary, the way that you have helped the Fatty Liver Foundation to grow and thrive, and Tony, the heart and creativity that you and Gina are bringing to NASH knowledge and making it so much bigger. You talk about it sort of a Pittsburgh thing, but you've made it so much bigger and so much more impactful that I am with all of you, all of us together. I've never been more optimistic about our abilities to affect change in a disease state than I am for us in NASH in 2021. And that includes all of you listening and watching on this summit. And so now, Grace, I will turn this back over to you. Thank you.
Oh, thank you so much, Donna, and thank you everybody for sharing all your perspective. This is a Christmas jumper. I thought I'd put it on just to close the meeting, but it's actually not very clear on the screen. So thank you very much, everybody, and what a fantastic end. I wish all of you the very best for next year, and I echo Donna's sentiments. I feel very optimistic, and I hope we will get to see you all very soon. So thank you.
Thank you.
Brilliant.
Thank you.
Bye.